So after you come in through the James Street garage, you'll have the ability to come through our metal detection area, and this is set up right before you enter into the emergency department lobby.
After patients check in at our registration desk, we do have our adult waiting room separated from our pediatric waiting room in the new emergency department. In addition, in the waiting room, we'll always have a nurse stationed 24/7 directly adjacent to security to be able to identify any patients having acute medical emergencies. And this is our pediatric waiting room, which is very secluded from the adult waiting room for enhanced privacy. We also have a pediatric board with images to help keep children occupied while they're waiting for care in our emergency department. This is one of our new triage rooms where the clinical team will assess jointly any patient presenting for emergency care. We do have care boards inside of our patient rooms which help notify patients of where they are during the duration and stay and progress in their emergency department stay. In every nursing pod in the emergency department, we have an Epic care board for ease for the clinical team, for better identification of where patients are located throughout the emergency department, for our internal clinical team, and also our admitting providers. This is one of our team stations in the emergency department, and we have computers close to one another for good collaboration. In addition, we have an ED communication board in each team station where we will portray important weekly updates for our team members each week.
This will sort of take all the information that previously wasn't immediately available to staff. We can talk about orders that are placed, the providers who are involved in the patient's care, give them a rough time frame in terms of test results, if there's any special precautions such as respiratory, obviously with COVID, and it'll identify allergies and certain things like fall risk, just sort of give you a good comprehensive picture of what's going on with the patient. This is what we call one of our resuscitation bays, typically reserved for patients who are more acutely ill, critical care situations, and it's similar to our prior resuscitation bays, just enhanced in terms of some of the equipment and the technology. I can give you a quick run through. This is similar to what you'd seen in some of the other rooms. It'll give us updated information on patient, the provider, status of test results, things along those lines. Computer for the nurses who are recording critical information, test ordering, pulling medications can be ordered through here. This is our what we call a critical care cart, mainly used again for resuscitations and patients who are either critically injured or critically sick, heart attack patients, things along those lines. Stretchers are obviously new, but relatively similar. The other thing that's new is we have hoists for patients who require lifting assistance, may not be sort of easily mobilized. It helps staff and reduce the risk of injuries. And over here, one piece of technology worth pointing out is a glide scope, and it's a video-assisted intubation device. Whereas previously, everyone who's watched ER and other shows on TV, you see them sort of looking directly over the patient and trying to place an endotracheal tube with direct visualization. Standard of care in a lot of situations now is to use video-assisted equipment, and that's what we have in all of our resuscitation rooms.
In addition, in our critical resuscitation rooms, we have new and improved patient booms that are more easily able to be moved around the patient and physician to hook up oxygen, suction, any of those medical interventions. In addition, we have a redundancy monitor for the emergency physician who may be intubating or securing an airway for a patient to be able to see a patient's crucial vital signs when he or she is at the head of the bed. So it's been positioned very in a strategic position. And then in our critical resuscitation rooms, we also have advanced supply cards for needs that we may have to resuscitate patients.